San Diego in July of this year with a goal of creating opportunities for our research faculty and postdocs and guests to have an opportunity to talk about their work in digital health and artificial intelligence to not only showcase what they're doing, but to really help elevate conversations about the ethical, legal, and social implications that are associated with the work that our community is doing. Last month, or I think it was in July, we hosted our first seminar with Dr. Rayanne Moore, who talked about digital phenotyping and some of the challenges that she has with privacy and data management. And so uncovering some of these nuggets of challenges are things that we can share as a community and also learn from one another. So that's one of our goals here. And with our speaker today, I'm going to go ahead and introduce Dr. Olga Perski. She's a postdoctoral fellow who I've known for a couple of years. She's working with a colleague of mine, Dr. Eric Heckler, who is an associate dean in the School of Public Health at UC San Diego. And Olga is an interdisciplinary researcher. She's working in behavioral medicine and addiction and digital health. And her focus right now in her project is on technology and enabled time assessments and dynamical modeling. And this all fits into the work that she's doing on just-in-time adaptive interventions for smoking cessation and alcohol reduction. Those are also called JEDIs. Olga, I'm going to go ahead and turn it over to you, and you can add to that introduction. And I'm just really excited about the topic that you're going to be speaking about today, which is on open science. And so the title is Open Science Practices to Advance Digital Health AI Research, Balancing Ethical and Legal Hopes and Fears. And this is, again, just for those of you who are new, this is the format that we have is a virtual presentation followed next week by an in-person brown bag. And we'll give you more information on that at the end of Dr. Perski's presentation. So I'm going to turn it over to you now, Olga.
Thank you so much, Camille, and thank you so much for having me. And it's great to see so many people here today as well. So I'm going to go ahead and share my screen. And I hope that you can all see that. I'm seeing some nods. Great. Yeah, so although I have some quite specific projects, of course, related to digital health and machine learning. But what I really wanted to focus on today is this topic of meta science and open science, which does permeate my work. And I'm hoping to show some examples from my own work and also start thinking a little bit about both sort of the pros and cons of using open science practices in our digital health work, and ultimately to then start a conversation with all of you, and hopefully that can continue next week during the brown bag session. Also, in the spirit of open science, you can find my slides available on the Open Science Framework, so you can access that through scanning that QR code. Okay, so let's dive straight into it. And I think my point of entry into talking about open science is really the reproducibility crisis in psychology and beyond, also in public health. The Open Science Collaboration got together to try to replicate 100 psychology studies across 3 of the main psychology journals, and found that although 96% of studies found significant effects in the original studies, only 36% of studies then could reproduce these effects in this collaborative effort. So it does seem like there is quite a big issue with sort of the phenomena that we are uncovering in our science, that they're not really replicating. And then sort of the other side of the coin is also that particularly during the COVID pandemic, there was an increase in public health research, psychology research, trying to look at the consequences of the COVID pandemic. And what was found here as well, so I've just included a screenshot here from Retraction Watch, which is a not-for-profit organization which is indexing retractions of scientific studies. And what's quite problematic is that already at this point, almost 400 studies addressing COVID-specific research questions have actually been retracted at this point. So kind of what I showed you on that previous slide is maybe also some more sort of clear examples of research misconduct, but what's really thought to underpin the reproducibility crisis is not necessarily fraud or misconduct, but what's known as questionable research practices. And in this seminal study by Judd and colleagues, they actually found that some of these research practices in psychology, such as collecting more data after seeing if the results are significant or not, or maybe even stopping data collection after achieving the desired results, they're actually quite frequent in psychological science. So then, what's the solution, or one possible solution to the reproducibility crisis? Well, this is where open science practices come in. I quite like this overview from UNESCO because it's thinking quite broadly about what open science entails. So we're thinking about open scientific knowledge. Kind of at one end is to make scientific publications open access, but then also going much, much further to enable the scrutiny of methods, both in terms of study designs and also analytical methods, and then all the way through to making hardware and software open source. But then, of course, there are also other aspects of the open science movement, such as open engagements of different societal actors, thinking about citizen and participatory science, and then also fostering dialogue with other knowledge systems, such as indigenous peoples. And so I really think that this is quite a lengthy quote, but when I was thinking about really trying to capture the hopes of the open science movement, I really think this is capturing it very nicely. So science is really a social enterprise, and we work together to accumulate knowledge as a public good. And the credibility of scientific claims is rooted in the evidence supporting them, and this includes methodology, the data acquired, and the process of implementing the methodology, data analysis, and outcome interpretation. And here is really the crux, I think. So claims become credible by the community reviewing, critiquing, extending, and reproducing the supporting evidence. But without transparency, then the claims that we make, they only achieve credibility based on trust in the confidence or authority of the originator. So transparency is much superior to trust. So then what might open science look like in practice? And here is I'll draw on quite a few examples from my own work throughout this talk. And this is an example from some of the work that I was involved in during the COVID pandemic. So when we were seeing a lot of studies being retracted, most notably were a couple of studies involving Surgisphere, a company with falsified data. But really here, we were conducting a living review and consistently updating this review. And the particular research question here was thinking about the association of smoking status with COVID infection, hospitalization, and mortality. So didn't have much to do with digital health or AI. But what we did here is that we made the data sets underpinning these analyses openly available. We also made our statistical codes openly available on GitHub. And then also what you can see is that it was very easy for people with some code knowledge to then actually reproduce and possibly extend the analyses. And also we were able to automate all of the tables underpinning the analyses, which also then helped to prevent errors when publishing subsequent versions of this. So then thinking a little bit more about, well, what are the benefits of open science kind of beyond these broader benefits for science and society at large? Well, so there's now been research looking into this, and what we can see is that open access publications, and particularly preprints of publications, so this would involve posting a version of the manuscript on an open preprint server, like medRxiv or SciArchive. So when preprints are posted, they actually, the publication then accrues more citations. Also, funders are increasingly interested in and mandating the open sharing of research. Also, which is linked to, I believe, the increased citations, is also that because of increased visibility when using open science practices, this can also facilitate new collaborations. So other scientists across the world being able to access the research and see that people are working in a given area way before it's gone through the whole lengthy sort of publication process, or the traditional, let's say, publication process. And also importantly, it facilitates data syntheses like meta-analyses. So when we do have the data sets openly available, this makes it much easier. So then what might sort of the adoption of open science practices look like more specifically in digital health and AI research? So I'm going to sort of provide an overview of a few different initiatives that are currently ongoing. There are, of course, many more, but this happens to be an initiative where I'm a co-director, and it's called the Open Digital Health Initiative. So perhaps going a little bit beyond sort of making data open, materials open, the aim of the Open Digital Health Initiative is also really to sort of increase the scalability and accessibility of evidence-informed digital health interventions, particularly in the area of behavior change, but also going beyond this. And so how are we doing that? Well, we are also curating sort of a discussion series, a seminar series, and making the resources available on our website. But then also importantly, we are working to create a database indexing available digital health tools, and also then being able to index sort of the level of openness of the different digital health tools. So for example, whether data and source code are available. This is sort of also, we're taking a systematic approach to creating this database. So we're currently going through sort of a modified expert consensus methodology to first try to identify the different entities that we would like to have data available on within this database. And then we'll essentially conduct a living systematic review to help populate this database. But there are other initiatives out there, of course. So notably, we have the Digital Biomarker Discovery Pipeline, which in partnership with OpenM Health have the vision to make sort of analytical code and machine learning algorithms that have been used to discover digital biomarkers that are associated with particular symptomatology or disease states openly available to other researchers. They're also working hard to create educational resources and also to create a platform to help researchers and practitioners to use these different machine learning algorithms themselves. Also, sort of slightly similar initiative is the FLIRT initiative, which is also working on creating signal processing algorithms to transform wearable data. And they've created a Python package to enable researchers to use these algorithms. However, and this was brought to my attention by Dr. Nebeker, is that, of course, there is also a discussion out there at the moment that there are some actors, and particularly perhaps more in the industry setting, that also use the term open science or open source, such as OpenAI, without perhaps actually using the terms in a similar way to sort of how, for example, myself might be using these terms. So I hope that by now I've sort of explained a little bit about what sort of the benefits of open science, what might these practices entail, and sort of initiatives out there that are really trying to implement open science practices. But I think overall, what we can see is that uptake of open science practices has been rather slow. And this might be due to some negative expectations, or what we might call fears, or kind of barriers to uptake. So what I was hoping to do now is to go through some of these common sort of barriers. Some of them are from available literature, but also a few of these have arisen through conversation with different scholars and practitioners, and sort of yeah, so I've really tried to summarize them here, and then also we'll try to think about ways to sort of mitigate these barriers and think about how we can overcome them. But this is also, well, I think for some of them there are maybe slightly simpler answers, and some of them are very complex, and I don't envision that I'll be able to sort of address all of them, but I'm also really hoping to have a conversation with you here as well about barriers that you've experienced, and maybe also some suggestions for how to overcome them. So the first sort of common fear that I've heard a lot of people mention is the fear of getting scooped. So somebody might beat me to it. They might quickly publish ideas arising from data that I've collected or my team has collected. Or it might also be that they're sort of able to do better with my data that it took several years for me and my team to collect. And because they didn't have to sort of get into the nitty-gritty of data collection, maybe there is more time to spend on thinking about some more interesting analyses, for example. The second one is around error identification. So this is something that I've heard others talk about. I've also experienced it myself. So I will show an example from my own work. And this is about error identification. So yeah, I might be concerned that others might really pick up errors in my methods and data analysis. And this is really embarrassing, quite frankly. Then we have ethical issues. So it might be unethical to share individual level patient data, and particularly in digital health when we're working with intensive longitudinal data, for example, from ecological momentary assessments or wearables, or we might be working with really sensitive, in-depth qualitative data. The fourth one is around misuse of data and materials. So this might, well, definitely extend beyond kind of digital health research, but tobacco industry, big alcohol, big pharma might use my data or my materials for nefarious purposes. And then we have sort of the time investment. So all of the work sort of leading up to preparing analysis plans, documenting study designs, statistical analyses, making sure that there is time for quality control and archiving data and codes. It just takes too much time, and there's not sort of time or the ability to support skills development. Then we come to the issue of commercialization. So I might be worried that others are able to earn money using my hard work or my team's hard work. Or it might be that, well, I actually want to make money on my software or materials. So I might want to set up a for-profit spin-out company. And then finally is the issue around social norms. So it might be that, well, actually, within my team, department, institution, the setting I work in, people just don't value open science practices. So how do we overcome these? So I know that was that's a lot, but we'll now try to dive into each and every one of them, and then yeah, I'll just offer some of my thoughts, but then as I mentioned, I'm very curious to hear your thoughts as well. Okay, so when it comes to getting scooped, I think one way of tackling this is that you don't have to make sort of the entire data set available all at once. You can just use the variables that you've pre-registered in your analysis plan and that you then use in your article. And also you can make sure that you only make the data available once you've conducted your main analyses and you've pre-printed your article and submitted it for publication. And this is just to show an example from my own work where we've done this. So this is a machine learning approach using app data. And here the sort of data set is available to other researchers on GitHub. And I think my experiences so far have been really positive. And I've had other researchers contacting me about reusing this mainly for teaching purposes. And the sort of this data set can then be used for more than the sort of we originally envisioned as part of our team. Then we have error identification. And I think this is, of course, quite a tricky one because when we discover mistakes in our methods or analyses, this can, of course, be very embarrassing. But I think the sort of it's important to consider the sort of broader aims of science and that we really want to increase the accuracy of our findings. And so I think here we just need to actively work to really adopt a mindset of learning by doing and also constantly improving, and to think of this as being really part and parcel of the scientific process. So I have an example from my own work where I had to make an amendment to the paper because here in one of my tables, because I had done it manually, I just sort of mixed up some of the numbers. And that's also, importantly, something that can actually be prevented through using open science practices. So had I sort of automated some of this and the generation of tables through using, for example, R Markdown, which is also, of course, reproducible, then I could maybe have prevented this error from happening. And I'd also like to sort of highlight one of my, well, maybe not favorites, but yeah, I think it's a project that's really important, and it's called the Loss of Confidence Project. And really the idea behind the Loss of Confidence Project is that there's been this kind of argument that science is self-correcting, and that phenomena or findings that aren't really sort of reproducible, that don't really sort of exist, by virtue of doing science, we'll just sort of discover which ones are real and which ones are not, and that any errors will just be sort of weeded out over time. But then, of course, thinking back to sort of the reproducibility crisis and thinking about that some of these seminal papers in psychology that weren't able to reproduce, they're still being cited. So I think we're seeing evidence that this isn't really happening in practice. But really the Loss of Confidence Project is sort of encouraging some of these ideas about sort of constantly improving as a scientist, and thinking about that, well, our sort of theoretical and methodological understanding evolves over time. So really being transparent about this and maybe writing about this, getting it out in the literature is something that's really important. Okay, then we get to some of the sort of more ethical issues as well, and thinking about sharing individual level data. And this is, of course, a very tricky one, thinking about protecting individuals, their privacy, but also thinking about maybe some concerns around that that it's not actually possible to share these kinds of data. But first and foremost, I think now at this point in time, actually most legislators do encourage publication of research data. Of course, informed consent from participants is key. And often it might be that sort of removing all of the identifying information from the data could suffice. But of course, it might not always be appropriate to share the entire raw data set. And I think what's really nice as part of the sort of discussion around this, and a lot of it is coming out of the qualitative kind of research literature, is also to stop thinking about it as kind of like a polar opposites, or that either something needs to be entirely open or entirely closed. So really thinking about different levels of openness for different projects, and thinking through what sort of the appropriate level, and really to try to also protect against re-identification, of course. Another kind of approach that's used more in the quantitative literature is to think about, instead of sharing the actual raw data, we can produce a synthetic data set. And this synthetic data set is really just mimicking the statistical properties, or perhaps most of the statistical properties of the data set, that still allows other scientists to scrutinize the data, but it's not sort of akin to actually sharing the raw data. So here was just also to highlight, because I also promised to sort of share resources throughout that I think are worth looking into further. And there's some really nice work coming out of Ireland at the moment, thinking about good practice guidance for sharing qualitative data. And also, I think this article by Peter Branney and colleagues is also really nice to sort of start the conversation around qualitative data sharing. Okay, and then we come to some of the issues around misuse of data and materials. So we of course know that big tobacco, big alcohol, etc., are known to leverage research data and maybe also specific materials or kind of messaging strategies for commercial purposes. And the argument here is that if we do kind of share more than what's sort of in our research articles, which is maybe more around the phenomena themselves, maybe group level differences or some sort of effect, or it might be sort of individual trajectories over time, or sort of responsiveness to different messaging strategies. The worry here really is that if we share more than that, then maybe we're sort of helping these industries to become better at targeting and advertising. And I think this one, I mean, there are probably a bunch of different perspectives on how to manage this. So some of the thoughts I had around this was maybe, again, coming back to sort of considering different levels of openness, but then also maybe shifting the focus a little bit more to sort of regulation to restrict advertising. And this is also, of course, because, well, one of the papers I highlighted here around tobacco promotion, and this is really thinking about research studies looking specifically, for example, right now, and bringing in the digital perspective as well, that tobacco advertising across different social media is really associated with increased use of tobacco, for example. So the evidence is out there, and the tobacco companies are, of course, able to use this information to their gain. But then really, what can we do to prevent this from sort of affecting smoking rates? And maybe this goes beyond sort of the data sharing and sort of individual level data sharing in is perhaps a broader issue. But here, yeah, very interested in other thoughts on how to mitigate this. Okay, and then we come to the point about open science being too time consuming. So of course, pre-registration of study designs, analytical plans, all of the documentation, it does take a lot of time. But I think as with a lot of different things, sort of this is an investment for the future. The more we do this, then it can save time in the longer term. And also really, I think one of my experiences from doing this is also throughout sort of the publication process, it's quite common that our manuscript might sit with the journal for several months, and then you finally get the peer review comments, and then the reviewers are asking you to go back to your analyses, maybe change something, or maybe run sort of an exploratory supplementary analysis. And really, it can be very, very helpful to then have implemented some open science practices. So if you, for example, have clearly set up your code to run automatically, you've clearly annotated what every line of code is doing, more or less, then that can also really save time and kind of help you to just jump back into those analyses. And then also I wanted to highlight that there is a wealth of mostly free resources available. And also a lot of these skills, I think, are also transferable skills. So for example, the code writing or registered reports is also something that can apply not just sort of within scientific research, but also in other areas of health work. And then we get to the question of commercialization. So here, I think there's also perhaps a few more options maybe than sort of just making it fully open or fully sort of private. There are different Creative Commons licenses, for example, to explore. And also one can specify if derivative works should be published under the same license. So these are called share-alike licenses. Of course, it's often challenging to then prove that somebody has sort of built specifically on your work. And then there are, of course, also lots of different business models for still making profits, even though you're working with open source software. So, for example, software as service or dual licensing. So I think here there's probably a wider discussion that could be had around the different options. Okay, and then we do get to the final one. And this is around social norms. I've highlighted some of my previous work on this, which is focused kind of specifically on digital health interventions. But I think the same principles, interestingly, apply here as well. And it's around that, well, as soon as we sort of introduce a new innovation, so it might be digital health tools more broadly, or here it might be the use of open science practices, we often have this sort of distribution, which has been called diffusion of innovation by Everett Rogers. And thinking about that, well, in the beginning, of course, there will be sort of a small proportion of the population that we're talking about who might be thought of as innovators or early adopters. And then in order for sort of the innovation to diffuse across the whole population, there are, of course, some factors that can sort of make this happen. So some of them, I think, are around sort of social proof, or if important others, perhaps healthcare professionals, are sort of endorsing open science practices, then maybe it's more likely to spread. And also making the activities of early adopters more salient within a department or institution can perhaps also help. And then, of course, as well, coming back to sort of what I was trying to do in the beginning of this talk as well, is to emphasize the impact of what what are the sort of benefits to individuals and society at large from adopting these practices. So, for example, increased citations or media coverage, or also patient testimonials. So these were just some of my thoughts around open science practices. And with that, I would very much like to open up the floor and hear from you and think through these points in more detail. So thank you very much.
Olga, thank you so much. This was fantastic. And I'd like to open this up to questions. If you want to put questions in the Q&A, or if you want to raise your hand and ask a question, we are very flexible. And while I'm waiting to see a hand, I'm going to go ahead and ask you a question, because I'm really interested about, well, I think most everything you listed has ethical implications. And I guess that's just kind of how I see the world. So whether it's, error identification or who can access, misuse of data, all of those they fall under that ethical umbrella. So I'm thinking when you talk about informed consent and de-identification, so those are things that I think are pretty difficult to even conceptualize for people. Like, what does that mean that my data will be open and who can have access? So I'm curious about how to convey to people who might participate in a study prospectively that you are placing data in a location where anybody can have access to it. How do you convey that upfront? And then maybe you decide later that you want to put these data in a public repository, and you didn't get consent from that upfront. So when I think about, like, you can either do it prospectively, or you can attempt to de-identify it so that that individual couldn't be linked to those data. But that's really hard to do. So I'm trying to think through, how do you manage that, that wanting to be open, but also protecting individual rights and allowing them to consent to that. And then I have another question if nobody raises their hand, but that's my first one.
Yeah, thank you. I will start sharing some of my thoughts, but then, I'd be very interested to hear from others as well. So I think building it into the consent process might be a good way to go, and really asking for consent up front before people even, or sort of when considering to take part in the study. But then, of course, comes the question of, are people really aware of what that will look like? So I myself haven't really sort of played around with, or maybe even doing a dedicated study to think about different ways of presenting the information, and maybe doing a think aloud and ask people sort of what do they imagine from kind of the presentation of text, or maybe there is something visual even to show what it will look like. So I think that would be very welcome to start thinking about maybe conducting some of that research. And sort of thinking about the risk of sort of re-identifying patients or participants. So of course, this is a very tricky issue, and there is some research that's shown that by using machine learning models, it can be relatively easy to link people back to sort of identifiable information. However, I think if sort of redacting a lot of details around kind of location or also important demographic characteristics, then in order to really link people to sort of identifiable information, kind of creates a huge search space as well. So and really being able to kind of train these models, I think that's seems like maybe a concern that, I mean, could be also with generative AI and kind of thinking about linking all of these different data sources. And sort of, yeah, how to mitigate that is, of course, well, carefully thinking about which variables to share, and maybe also thinking about, for some variables, not really, I mean, so age, for example, as a variable, never to share the actual date of birth or even the specific age, but thinking about age categories, for example. So there might be ways of making it much harder to re-identify participants. But yeah, I'd be very interested in other people's thoughts on this or other approaches.
I'm still not seeing any hands. Oh, Brian, hi. Yeah,
I'll raise a hand. I think much of the silence, Olga, is probably because no one has a great solution for any of these, which is why they are persisting as problems. And I just wanted to highlight yet another one, which is the too time consuming one, which is the main one that I hear from people who are generating data. It's not just time, but it's also finances. And I know that now that NIH is starting to recognize that and allowing PIs to put some money around it. But from what I can tell in some of the big studies that I've been involved in epidemiology, it is like it's multiple people full-time for years to get the proper documentation. And in a lot of these studies, there is a lot of complexity, and it spills into the misuse. I think you highlighted some of the potential conflicts of interest in misuse on purpose, but I think that I've also seen a lot of cases where there's misuse because there's not proper documentation, and then they're not analyzing the data correctly. I don't have any great solutions, but I'm curious your thoughts on whether the current solutions are moving in the right direction, or they're moving the needle sufficiently of basically allowing some money to hire one person, let's say, to put some documentation.
Yeah, thanks, Brian. Yeah, I really appreciate that point. And maybe also sort of, well, one way of thinking about it, which is maybe common to sort of a lot of challenges in research more broadly, is also to think about sort of maybe short-term solutions and then also long-term. So I think my experience as somebody who is still an early career researcher and kind of in my, well, actually towards the end of my PhD and sort of first years of postdoctoral work, happened to be in a place, I think it was really about sort of, you know, you find yourself somewhere where there are some open science advocates. And because of that, and during that time in my training, I also had time to pick up some of those skills. But I think if, well, trying to also incorporate some of these practices within our educational programs and kind of moving from sort of routine use of sort of more graphical user interface type of software for statistical analyses like SPSS, moving into R and Python, then maybe we're also able to build a workforce that kind of, yeah, has more capability to kind of use these skills routinely. But then, of course, yeah, the short term and sort of thinking about how do we manage it here and now and for large scale studies, then yes, we do need resources and kind of dedicated time for the documentation. And I think really, yeah, it seems like a decent thing to do to be able to budget for kind of documentation and within NIH funded research. That's just my sort of, yeah, maybe opinion on that. But yeah, it's of course, yeah, a challenge sort of short and long term.
So when you're talking about like how to put this into the skills and training pipeline and the things that you were able to do because you were around, you intersected with people that were advancing this area, but also had the time to develop the skills. If you were to think about what would it look like if you started to implement practices within a graduate degree program? Would it be open notebooks? And would it be teaching students how to keep their data in an open platform? So I'm curious about how you see this happening more as a cultural shift.
Yeah, thank you. So I think by now there are quite a few nice examples, I think, and for anyone who's interested, there is this, well, anyone working kind of more in the psychological space or public health, there is a society called SIPS, or the Society for Improvement of Psychological Science. They came together a few years ago and also were instrumental in setting up PsyArchive, one of these preprint servers, and then also moving on to setting up sort of, I think they're called Diamond Open Access journals. There's one called Collabra. But also as part of this community, there's now quite a few different examples of how to set up teaching resources or really implementing some of this teaching kind of within undergraduate and graduate programs. And really, I think also, sorry, I should mention as well, there's, yeah, from the UK and Ireland as well, there are some really nice examples of kind of setting up specific, it might be a module or a course or kind of, yeah, a whole course focused around open science practices. And probably, I mean, a first step, I think, particularly for kind of people with a background in psychology, sociology, public health, might be this kind of move from using graphical user interfaces to sort of coding, and then becoming comfortable with that, and also becoming comfortable with sort of data wrangling, twisting, turning data, thinking about what does it actually look like, distributions, and kind of at the individual level, at the aggregate level. And then, yeah, also thinking about exactly what you mentioned there, Camille, with sort of open notebooks for codes, and then also becoming comfortable with different repositories and sort of what might that look like. And of course, also thinking about documenting the different variables and variable names, or also kind of the frequency of assessments, response options, and really thoroughly documenting that, which is also, I think, can be really helpful for kind of fostering understanding of what sort of each study is actually doing more specifically, so can then also kind of feed back into thinking about study design and really, and of course also, well, theoretically thinking about the constructs that we're trying to measure and the sort of measurement instruments, etc. But yeah, sorry, that was a bit of a long answer to that. I think, yeah, if anyone is interested in sort of starting to implement this into teaching, there's definitely a lot of different resources out there, and because also some of these courses would be available openly as well for others to kind of build on. Yeah.
So with Brian's comment about taking years and full-time people and the complexities of the data, making it's just too cumbersome, I'm going to ask you, Allegra, because you put in some resources for the library. Because this came up last month when Dr. Rayanne Moore was presenting on the burden of creating the data sets so that they're aligned with the NIH repository expectations. So what is it that the library can offer to support this direction?
Yeah, so there's a lot that we can offer in both spaces, both the publishing and open access to data and that kind of thing. So the links that I put in the chat were to our research data curation program. So this is entire group of people, staff, who help you make a plan from the beginning. So as you're starting your research, so that you're following kind of best practices and standards, all this kind of research on the research, how to best present it so that you don't have to go back and reconfigure things, or so you're thinking ahead and planning it. And they also work with people as far as, say you're at the later stages, like we're talking about now, how most efficiently to get the data in shape for meeting these requirements, because there's the OSTP memo, which is calling for public access to both your publications and now your data and software and whatnot. And this is for the major US national funders. So we're trying to get ahead of it and let you know that there's like services out there. And that education piece, as you were talking about, the libraries do a lot, and this is international. I notice you're from the UCL, and there's a Open Sciences services there as well. We try to get ahead of it and do a lot of education on open science, as well as, the humanities and social sciences, other disciplines as well. So there's a lot of resources out there, and entire communities that come together.
Thanks, Allegra. I tell you, I have a lot of questions, so unless somebody else is going to raise their hand. One of the things that I saw on your slide was open, restricted, and controlled by data access committee. So there's different tiers that you described that I think are super important. And I was wondering if you could speak to how those tiers are constructed, like what should always be open to anybody, what should be controlled / protected / restricted, and then what should have to go before a committee to set free these data?
Yeah, so I suppose some of that thinking has come out a bit more from the qualitative method space, so some of the papers I shared. So it's actually not something that I've implemented myself in my own work yet. Yeah, I can't really speak from sort of first person perspective there. But yeah, I think sort of in terms of what, the minimal kind of level of data that should be open might be things to do with sort of metadata, and really thinking about if somebody were interested in sort of reusing the data or finding out more, that there is some level of information there. But then really, I think it might also be sort of from some of my experience as well, working with population level survey data at UCL, then we've had discussions there as well about sort of thinking about there is maybe more to do with sort of what I was talking about with sort of age data or some specific variables that are particularly vulnerable for sort of re-identification, and that might be something that goes up to committee review. Yeah, so those are my thoughts there, but I don't have too much sort of practical experience myself. They're just, very interesting ideas, I think.
And I think on one of your slides, I saw the name of somebody that I'm not recalling right now, but it was somebody affiliated with Sage Bionetworks. And they've put together some really nice approaches to open science that would be a good resource that I'll track down and share with this community that's beginning to attend our Cultivating Conversations seminars. And we're coming down to the last few minutes, so I wanted to make sure that I not only thank you for an excellent presentation, but to let everyone know that next week, Tuesday at 1 o'clock. Now I'm going to ask Star to tell us the details about the brown bag, but we want to get together and continue this conversation, because there are so many aspects, nuances that are really important to try to unpack and to continue to ask about. The Creative Commons licenses is something that I think I've just recently learned that you can make changes to those. You can not just take what is given to you on Creative Commons, but tailor it to make it appropriate for whatever protections you're trying to create for the data set that you want to put out for public use. I'd like to think more about what kinds of codes of conduct, what types of attestations we might want to see in place to promote self-governance and promote citizens with good behavior and good intentions that are accessing these data repositories. So what would those look like? Have you seen any good models of these types of approaches to self-regulation, I guess is another word, self-governance? So Star, thank you. She has put in here the schedule for our upcoming events. We would love to have you complete our post-presentation evaluation. And for you, Dr. Perski, whenever you give a presentation like this is something that you can put in your academic file, and we'll give you your evaluation so that you can have that as well. But we will be here at Atkinson Hall at the UCSD campus next Tuesday, the 26th from 1 to 2. I'll ask that you let the research ethics program know if you're planning to attend so that we can plan to either have a brown bag or order some pizzas. And either way, we look forward to seeing you. Are there any comments, Star, that you'd like to add that I may have forgotten?
Just that the link for the post eval is in the chat. You guys could click on that before you leave. And then for the brown bag, I'll be sending out an email. So if you do want to come, you'll be able to respond to that and let me know.
Excellent. Well, thank you again, Dr. Perski. This was really fantastic, and we're really happy that you're a part of our community and helping to cultivate conversations about the ethical, legal, and social implications of digital health and artificial intelligence. Thank you.
Thank you so much for having me.